So I imagine, based on what's been said, this is pretty abnormal, having so many parents attend an IU board meeting. If it is the case that that's abnormal, I would like to personally welcome you to the new normal. So who are we? What are we here for? Well, we're a group of parents and concerned citizens who care deeply about the well-being of the students in Bucks County, including our own, of course. We're here tonight to confront the past so that we can protect our children's future. Those who fail to learn from history are doomed to repeat it. Through public record emails obtained from right to know requests, we have witnessed the story of how this IU undermined the credibility of Dr. Damsker and the Bucks County Commissioners, specifically to influence school guidance. This resulted in the denial of an in-person education to tens of thousands of Bucks County students. So in case any of you are unaware, and it sounds like based on commentary from the board tonight, many of you are unaware of what happened here between April and June of 2020, we're about to share part of the story with you so that we're not doomed to repeat the same mistakes in the upcoming school year. A little bit of background. The syphilis law, as I like to call it, has already been mentioned. The Disease Prevention and Control Law of 1955, it says this, quote, "Local boards and departments of health shall be primarily responsible for the prevention and control of communicable and non-communicable disease, including disease control in public and private schools," end quote. To paraphrase, the Bucks County Department of Health has legal authority of our local pandemic response, which includes the health and safety guidance of public schools. So from the start, this has been very well understood by educators throughout the region. Over in neighboring Montgomery County, this was referenced earlier as well, a superintendent of a Montgomery County district said, quote, "Dr. Arkush emphasized again the important distinction in Montgomery County of the fact that we have our own health department. While PADOH provides important guidelines, Dr. Arkush continues to emphasize that Montgomery County has authority to govern decisions." So they knew next door. At the start of the pandemic, the Bucks IU appeared to be thankful for Dr. Damsker's expert guidance. An early email from IU personnel said, quote, "Dr. Damsker is heading the efforts to address the pandemic response in Bucks County. The Bucks IU is very thankful for his availability and expert guidance." Unfortunately and sadly, this trust and gratitude to Dr. Damsker was short-lived.
In early April 2020, Peter Malamus began sharing COVID data slides. Excuse me?
Okay, fine, sorry.
No worries. With Rebecca Malamus and Mark Hoffman. On one data slide, he states data is sourced primarily from the COVID Tracking Project, Pennsylvania Department of Health, and STAT. The Bucks County Department of Health was not listed as a data source. On April 13th, Mark Hoffman received an email from Peter Malamus with another COVID-19 data presentation and replied to him, "Thank you. May I share forward to county hospital leaders, supers, and others?" Peter replied, "Of course, no problem." A slide of this presentation is titled Bucks County, PA, Cases and Increase Rate, in which he lists the PA Department of Health, not the Bucks County Department of Health, as the source. This is important to note as in the spring of 2020, there were questions about differences in county COVID-19 data and COVID-19 data coming from the Pennsylvania Department of Health. Rebecca Malamus acknowledged these differences in an email written to Bill Horner on May 4th. "I know there are some questions among Bucks County officials in using this data to make reopening decisions, and according to news reports, there appears to be disagreement between Bucks County and the governor's office on the use of this data to make opening determinations. In late April, the Bucks County Department of Health was reporting that the bulk of new COVID-19 cases in Bucks County were coming from nursing homes. On April 23rd, in a press conference, for the Bucks County government, Dr. Damsker said, and I quote, "We've seen a shift in the types of cases we are seeing from community type spread over to congregate care facilities and their residents and staff. And we are seeing usually between half to 2/3 or even more some days of cases directly from those facilities." Peter Malamus decided to weigh in and share his thoughts on the nursing home situation with Mark Hoffman. On April 27th, 2020, he emailed Mark Hoffman and Rebecca Malamus a set of 5 slides discussing the Bucks County nursing home data and said, and I quote, "Mark, attached is a first draft of a quick look at how overall activity in southeast Pennsylvania counties compares to the percentage of state population each represents and the nursing home data. Bottom line is that, at least from this data, southeast Pennsylvania county overall, activity approximates their state population's percentages, and for Bucks County nursing home cases do not represent a disproportionate amount of cases or deaths compared to the state averages."
On April 28th, Mark Hoffman sent Peter's text and slides to the Bucks County superintendents and wrote to Peter saying, quote, "Very helpful, I shared with the team. Thank you for the follow-up and for sharing your expertise with the county. Our local government should be working with a company like yours to inform," that's all in big capital letters, "to inform the public and help our elected leaders make decisions," end quote. Peter responded, quote, "Thanks and no problem. I'm sure the county folks have access to all kinds of experts. Whether they listen to them is a different issue," end quote. The week of April 27th, Bucks County Commissioners wrote to Governor Wolf and asked that the coronavirus cases in nursing homes be considered separately, giving the county more flexibility in reopening. On May 4th at 12:47 p.m., Mark Hoffman shared an article with the Bucks County superintendents in which Dr. Damsker said, quote, "About half of all Bucks counties, more than 3,000 cases of coronavirus have been in long-term care facilities or among healthcare workers." At 12:55, Bill Harner wrote back, quote, "Do their numbers jive with Peter's numbers?" Almost immediately, Rebecca Roberts-Malamis forwarded Bill Harner's question to her husband. At 2:42, Rebecca Roberts-Malamis sent the following email. "Good afternoon, Dr. Harner. I took the liberty of forwarding your questions to Peter, and here is his response for what it is worth." On Friday, Bucks County Department of Health Director Dr. David Damsker said that about half of all Bucks counties, more than 3,000 cases of the coronavirus, have been in long-term care facilities or among healthcare workers. Per Peter, this statement is false unless they have data that shows at least 668 cases among healthcare workers, not at nursing homes. Example, hospital workers. Based upon state data outlined below, approximately 30% of Bucks County cases come from long-term healthcare facilities and their employees, end quote. After sharing data from the PA Department of Health website, Rebecca ended the email with this, quote, "Finally, to the extent that Bucks County may or may not be using the data from the Southeastern PA chart that Governor Wolf indicated would determine when the region moves from red to yellow, I'm attaching the updated numbers for this chart as of today. Peter prepared a template for the IU staff and taught one of our employees how to easily track these numbers from the National COVID-19 Data Tracker website. IU staff will update with charts for your consideration if this metric continues to be used as a baseline for opening."
I will always look back at the 2020-2021 academic school year and think about what should have been. Every Bucks County student should have had access to an in-person education from the start of the school year. It's what the Bucks County Department of Health, who had both expertise and the legal authority over schools, recommended and advocated for. On June 8th, Mark Hoffman sent out a letter which stated, quote, "At this time, all Bucks County public schools plan to return to school in the fall." On June 15th, the Bucks County Department of Health released guidance for Bucks County school reopenings. Here are a few of the quotes from the guidance. "We now face the task of planning for a safe and reasonably normal return to school in just a few short months. With the support of everyone involved, including students, their families, and district staff, this can be accomplished effectively. I, along with Scott Forster, the Director of Bucks County Emergency Management Agency, have met regularly with you, the Intermediate Unit Executive Director, 13 local superintendents, and 3 career and technical school directors for many months, beginning prior to the closures. This collaboration has allowed for the development of guidance based on medical and public health expertise in consultation with the needs and realities of school operations. While health and safety considerations are paramount, guidance also is rooted in our understanding and belief that social interaction and in-person instruction is essential to our children's emotional well-being, as well as their educational growth and advancement. Dr. Damsker's recommendations were well received in Bucks County and around the state. On June 16th, former Central Bucks Superintendent John Kopicki sent out an email saying Central Bucks is planning to return to in-person school. On that same day, Mark Hoffman emailed the IU cabinet saying, quote, "I understand that the Delaware and Chester County IUs and districts have asked their shared health department to consider adopting Dr. Damsker's guidance. I also understand that a similar request is occurring north of us in Northampton County. I also hear of similar talk out west near Pittsburgh." Rebecca Roberts-Malamis responded to Mark Hoffman, not Dr. Damsker. "Look at you. Your model is being replicated throughout the state. Kudos. Take a bow."
How did Dr. Damsker's guidance go from spreading like wildfire across the state to be completely shut down? On June 17, 2020, at 12:45 p.m., Jeffrey Solatnik, an education lawyer and sponsor of the Education Union, PSBA, sent out a mass email in which he included Dr. Dempster's guidance and the following commentary. Bucks County School Districts interpreted guidelines loosely in adopting 3 feet of social distancing standards with 2 students per bus seat. The language in the guidance, to the extent possible, in quotes, is where the district must accommodate the guidelines as much as possible, but they are not hard, fast rules. In other words, districts will have legal and regulatory flexibility. However, I don't think districts are going to be judged on the basis of legal or regulatory flexibility. Districts will be judged based on the various constituencies that they have within the school district, and I can assure the districts will, notwithstanding their best efforts, alienate one or more of those constituencies regardless of the terms of the district's adopted plans. 7 minutes later at 12:52, Rebecca forwarded the email to Mark Hoffman emphasizing Jeff's critiques. On June 24th, when the Department of Education, the PDE, issued back to school guidance, Mark Hoffman wrote, "On a call today with executive directors, the secretary reinforced that this is informational guidance only to help inform local decisions and that it is not mandated language. PDE maintains the position of local control in forming districts' plans of action." That was all in quotes. On June 25th was an important day. It was the day Dr. Dempsker provided a summary of his guidance on a call with the superintendents of the 4 southeastern PA counties. After the call, superintendents were raving about his guidance. However, it was also the day that Jeff Soltanic, I'm sorry if I'm butchering the name, sponsored by the Educational Union, PASPA, titled "Protecting the School Workplace, How to Reopen Safely and Address Employee Concerns." In this webinar, Jeff's a union-funded lawyer, not a doctor, spent 11 minutes ripping apart Dr. Dempster's guidance. And after giving the presentation, Jeff called Tina Villetto of the Montgomery County IU. In the email, Tina said, "I got a call from Jeff. He said he's just finished a presentation for PASPA, and most across the state did not like the Bucks guidelines. I told him our superintendents were sold on Dr. Dempster."
It's time to welcome Quakertown Superintendent Bill Harner back into our story. On June 27th, Bill Harner emailed Jeff Soltanic saying, quote, "One of my staff members listened to you earlier this week and heard your take on the Dempster model of reopening schools. Throw the doors wide open and welcome everyone back. Been disagreeing with Dr. Dempster since early March." Later that day, he emailed Mark Hoffman saying, "Just off the phone with Jeff Soltanic. This past Thursday, he had Dr. D's recommendation up on 4 to 5 slides. He ripped Dr. D apart and said he was setting up districts for legal issues down the road. Mark, who was about to leave for vacation, asked Rebecca to, quote, in an email, explore this issue this week. On June 28th, Rebecca reached out to Jeff and they scheduled a phone call for 9:30 a.m. on Monday, June 29th. At 3:39, she sent an email to Mark Hoffman with the subject, "Conversations with Dr. Harner and Jeff Soltanic in confidence." In this email, line by line, Rebecca shares Jeff's harsh criticisms of Dr. Dempster's. Here are 2 of the points she shared with Mark. Employees should feel confident and comfortable in the workspace, knowing that the maximum appropriate guidance is being followed. For Bucks County, the maximum appropriate guidance is CDC, not Bucks Department of Health. Most school districts are not taking the CDC regulations as seriously as they should. The Dempster guidance has played into this. In the right to know request from which this email was obtained, the second half of the email was quietly omitted. When a second request was sent, the IU responded by redacting the entire email. What is in the second page of that email that the IU does not want the public to know?
After their phone calls with Jeff Soltanic, Bill and Rebecca got to work. In the afternoon of June 29th, Rebecca sent the PASPA slide deck to all Bucks County superintendents, along with commentary that contradicted Dr. Dempster's advice. On the morning of June 30th, Bill Harner forwarded a message from Jeff Soltanic to every Bucks County superintendent. Jeff's bullet points. Jeff is an attorney, not a doctor. Not consistent with the approach of the Montgomery County Health Department. Testing requirements not recommended for return to school. Big mistake. Number 3, masks should clearly be required on buses, hallways, common areas for students. Teachers should be required to wear masks all day long with administratively approved exemptions. 4, the testing of individuals who had contact with an individual diagnosed with COVID-19 needs to be more fully addressed. This relaxed system only works with extensive testing and contact tracing. Again, an attorney's giving you this advice. On Monday, July 13th, Dr. Damsker sent this to all Bucks County superintendents. First, I apologize for raising my voice on the call. That was not helpful and did not improve any of the logic behind my argument. What's truly frustrating is we have a relatively low prevalence here in Bucks County and have spent untold hours and efforts trying to keep it that way. We have really good data here, and I want us to act like that matters. In my view, we are now starting to act on fear. And the ripple effect is spreading, and that's exactly what happened. I guarantee that no matter what model you use, you will have cases in your district because there are already cases in your district. Staff and teachers will get COVID in the community, at the store, anywhere. Kids can do and get COVID from their parents. Jumping to a hybrid model of 2 days a week in-person teaching is a worse idea. It has many of the disadvantages of the virtual model, less support from parents, more logistics and daycare issues, and there's no hard evidence that it will help at all when the teachers are still going to be in the same classroom with the possibility of getting infected, and the kids are going to be hanging out outside of school more, unsupervised. The start of the 2021 school year, 1 school district went back full-time out of 13, 1. The rest of the Bucks County schools started to offer 5 days in person here and there. Most secondary kids didn't go back until March, and none of them have had a full day and been able to eat lunch. Have you guys gone a full day without eating lunch? And still, school board members think they can vote against our health department, like you know more than them. It's embarrassing. You have thoroughly embarrassed yourself. This county has destroyed, you guys, what you did here was wrong. This should never have happened. You destroyed children this year, and it is not going to happen again. My kids went to school all year normally at a private school without wearing a mask. Nothing happened.
We have graciously decided at our expense to provide you with copies of everything referenced this evening. More than 14 months ago, this educational organization started down a path that seeded doubt, confusion, and a county-wide road to chaos. On May 4th of 2020, the IU issued an email. That email was referenced previously in this conversation. It went to every superintendent in all 13 of the districts, and it deliberately, willfully, and intentionally accused the health director of either blatantly lying or being completely inept. As we have all listened, the IU perpetrated this for months, and months on end across the entire county. Email after email, conversation after conversation. There is but one line in that email. Per Peter, this statement is false, unless they have some data that shows differently. Did you hear that? Unless they have some data. That's talking about the county health director. And it was at best the inference, he's either wrong, he's inept, or he's lying. We passed that to every single superintendent in the middle of a pandemic. You, the IU, legitimately and directly told every superintendent in this county that Dr. Damsker was saying was false. But you were kind enough to qualify unless they have the data. So let me get this right. You said it was false, but you couldn't actually swear to it because you never had the data that Damsker was working from yourselves. You fed this narrative with data from someone who had no medical degree, someone who had direct access to daily data. You ignored that. You used statistics from the Department of State, which the state themselves months later said were wrong. You've never addressed that. You swept that under the rug. You've never publicly said that to any superintendent or to any parent in this county. You willfully and knowingly challenged a man with a master's in public health in the middle of a pandemic. I mean, seriously, with information that wasn't directly sourced from someone who didn't work for the IU. someone who didn't have a contract with the IU, someone who has no legal obligation to this organization, and you pass that to every single superintendent in this county as the authority. Who are you? 13 districts, 13 different plans from 2021, all because the IU leadership decided to play public health director, all while using bad data from unverified third party. You ignored the person who was in your own backyard. You took away a year from kids. They can't get it back. You weren't scrambling. The timeline went on for weeks and weeks and weeks. This was orchestrated. Worried about the attorney? Worried about getting sued? You know, not one email, and we've got 3,700 of them. Not one of them, not one, said what's in the best interest of the kids. It was all about the adults in the room. The children can't get that year back, but that's gonna end tonight. Your own agenda is now going to be rooted in facts, actual data, and best interests of tens of thousands of children. And we're gonna be here to make sure that happens. It's a promise, because we care. And what happened this past year should never have happened. Thank you for your time, and please let us know when you'd like a copy.